So let's begin with the developments to bring a coronavirus vaccine to the United States. Moderna will request an emergency use authorization from the FDA to begin the vaccine distribution process. Company says the FDA will most likely discuss the authorization in a meeting on December 17th. Now, according to the company's data, the vaccine was nearly 95% effective in testing trials. Officials are continuing to sound the alarm, though, as Dr. Anthony Fauci warns we could face a surge upon a surge of the coronavirus. Millions of travelers, as you pointed out, Anne-Marie, ignored CDC guidelines to stay home during the holidays. More than 4 million people were infected in the country just in November. That is more than double any other month since the pandemic began in March. There are now more than 13 million confirmed cases in the United States and more than 266,000 confirmed deaths. Friday, we hit more than 200,000 cases in a day for the first time. CBS News correspondent David Begnaud is in Los Angeles, where hospitals are struggling to keep up with the influx of patients.
We're not going to stop living just because of COVID.
Millions of Americans were on the move again over the weekend as people headed home for Thanksgiving gatherings. That is despite weeks of warnings from state and local officials to stay at home.
The travel that has been done has been done.
The country's top health officials put on a united front Sunday with their blunt assessment of what is coming next.
We may see a surge upon a surge.
We are deeply worried about what could happen post-Thanksgiving.
It's going to get worse over the next several weeks.
As it stands now, 24 states set records for new coronavirus cases in the last week, while the U.S. reached about 180,000 cases per day. In New York City, despite a steady rise in coronavirus cases, Mayor Bill de Blasio plans to reopen schools next week for kids in pre-K through 5th grade. He closed them almost 2 weeks ago when the 7-day average positivity rate hit 3% in New York City. Now it's approaching 4%. But the mayor still wants to reopen schools after the Thanksgiving holiday while increasing testing and requiring consent forms. Meanwhile, the number of Americans hospitalized with coronavirus is approaching 100,000, and doctors like Joseph Veron are caring for them nonstop. He works in a COVID ward at United Memorial Medical Center in Houston, and he has worked for the last 255 days straight. That's him in this photograph, taken on Thanksgiving, holding an elderly coronavirus patient who was alone and weeping.
I'm telling him, look, everything is going to be fine, because I understand what's going on for him. You don't know who you are talking to. So especially in the elderly, they get disoriented very easy. They get frustrated because these are people that at some point in time, they were used to being in control. So out of the blue, you put them in a place where they are pretty much in a prison. I felt the need to help this poor gentleman. I mean, I have to do it.
So let's bring in Dr. Ron Elfenbein. He is the medical director and owner of First Call Medical Center to talk about sort of the latest news unfolding, particularly this morning. Moderna is expected to request action to have their vaccine approved. What does this mean for the future of vaccines here in the U.S.?
Good morning. So the process for quote-unquote authorization, not approval, very different, two different things from the Food and Drug Administration. So Moderna is going to request an emergency use authorization, not approval. So what the EUA, the emergency use authorization is the FDA basically saying that this is our best estimate that this, whatever product you're putting before us will work and has good data. It's very preliminary data, but it's the best that we have, and we want to move forward as quickly as possible. So that's kind of the FDA's way of fast-tracking, if you will, things to get out to the public. Most of the medications that we have to fight coronavirus, even certain pieces of personal protective equipment, so-called PPE, are covered under emergency use authorizations. And Pfizer just requested theirs a week ago on Friday, and Moderna is set to request theirs as well, which would then allow them, if that's approved, to distribute and give out the vaccine throughout the country and to American citizens.
Doctor, the CDC says cases are up 8 times higher than reported. Why are we seeing such numbers, and what kind of danger does this mean for how people interact?
It's interesting. I saw your bit before I came on, which was about people traveling over Thanksgiving and things like that, and there's a lag between when people test positive, when they're exposed and they get infected, and when they test positive, and it can be up to 2 weeks. So I suspect that Dr. Fauci and Dr. Birx, who were also on your program a few minutes ago, are correct in their assertion that in the next 2 weeks we're going to see a spike upon a spike in cases because of the recent massive amounts of travel that we saw despite warnings. So I think it's very concerning, and I think it's very scary. I was supposed to go away to visit my family. We canceled our plans. It was a bummer, and we were all upset about it, but we did what we thought was right. But I think that we're going to be seeing a large number of cases in the next week or two, and I think that hopefully those won't need hospitalization. But if the numbers stand as they are historically, then a certain fairly decent-sized percentage of those will need hospitalization. And as you pointed out before, Vlad, again, that our hospitals are kind of to the max to some extent already, and I think that this is just going to add to the fuel to the fire, if you will.
That's one of my biggest concerns, Doctor, sort of moving forward and heading into the holiday season, is that we have done so many stories now where hospitals have said that they're concerned that they're going to be running out of beds. And particularly when you look at COVID treatment, some people are in and out, but often people are in for, it could be up to a month, which means like those hospital beds are not going to open up anytime soon. And then we could see a rush of more people needing hospitalization. I'm wondering, what the fallout is. What can we expect to see from hospitals if we cannot lower these numbers? Does it mean that, maybe there's someone who might show up at a hospital who at another time would be admitted, but instead they're being told to go home because there's just no space for them?
That's a great question. I personally have had that happen where I've tried in the emergency room. I'm an emergency room doctor, and I've tried to admit a patient, and I just couldn't find a bed for him, not only at my hospital, but at other hospitals. Normally, if you can't find a bed at your hospital, what you do is you sort of call around and try to find a bed at another hospital, and if they have the capacity to take the patient, then they will. But it's come to the point now, to a large extent, where you just can't find anybody to take the patient because there's no beds. And that is a problem for people like in rural hospitals, for example, that don't have the ability, they don't have a neurosurgeon, for example, on call. And if you have somebody that desperately needs a neurosurgeon and there's no beds available anywhere with neurosurgical capability, then that is very, very bad for your patient. So it has really sort of rippling effects, if you will, that don't just affect coronavirus. When the beds are all taken up, people who need it for other reasons can't get the treatment that they need, because you can't just send a patient to a hospital without an accepting physician and a bed available for them. So, we're sort of reaching that point now where people who need care, not just coronavirus related, but other things, might not be able to get it. And that is very scary. I know in Maryland, for example, we opened back up the convention center that we had for a while. We sort of closed it down and mothballed it a little bit, and they reopened it recently to allow for a capacity, overcapacity for coronavirus patients to decompress the hospitals. And I would encourage all states to do those kinds of things where they can sort of bring all the coronavirus cases to one spot and decompress all the outlying hospitals so they can take care of the other patients that need care. I mean, remember, people don't stop having heart attacks and don't stop, having brain bleeds and things like that require emergency care just because there's a pandemic going on. So, all those people will still need to get the emergency care that they need. But if we don't have the beds for them, then that doesn't bode well for them.
And Doctor, nurses are reporting extreme fatigue from this influx of patients. Why is this dangerous for curbing the virus? And are we headed for a nurse shortage in the U.S.? I know that nurses have been working, in some cases, there are nurses and doctors that have been on duty for every day of this pandemic. At what point do we worry about their health and the health of their families?
Yeah, thank you for bringing that up. I think that is a really, really good point. Honestly, you say, is there a pending nursing shortage? There's been a nursing shortage. It's not something that is a surprise. There's been a nursing shortage in this country for years, and it's just been exacerbated by the pandemic. People are tired. This is emotionally draining, this kind of work. This is very taxing on your soul. It's taxing physically, of course, but you see people die. You see people in horrible situations without their families. They can't touch their families. They can't be with their families. It's horrible. And at the end of the day, you come home not just physically exhausted, but mentally, emotionally, and every way you can think of. It's really, really sad, and it's really, really difficult. Little things can make a difference. If you know a nurse or a doctor or a tech or somebody who cleans the rooms, if you want to buy them a cup of coffee or send them a treat and say, hey, I'm thinking of you. I appreciate what you do. That goes a really long way. People really boost people's spirits when somebody does something nice, because for the most part, in the nursing profession, in the medical profession, we deal with people in their worst possible. Certainly in the emergency room, we deal with people in their worst possible situations, and frankly, they're not always as nice as they can be to us. But we just kind of brush it off, and because they're in a bad situation and we're trying to take care of them. But if somebody goes out of their way to do something nice for them, that really goes a long way. So I would encourage people, if that's what they want to do and they feel that they can, by all means, do something nice for a nurse or a doctor or a tech or somebody who works in that environment. But yes, it is very worrisome. People's health is definitely at risk. You're tired, you're sad, you've been working a lot. You're going to let your guard down, and you do something that you wouldn't normally do. You break protocol. You don't wash your hands properly. You don't put on your mask properly. You can infect yourself, and then you bring that home to your family. So, Vlad, you're absolutely right that their health is at risk, as well as their families, because they will bring that home to their families. So, it is very scary, and it is very worrisome, and I think we need to do a better job of looking out for our healthcare frontline workers.
Yeah, it's an important note. Dr. Ron Elfenbein, as always, my friend, thank you very much.
Thank you, guys. Stay safe.
You too.